your at-risk breeds, such as boxers, German shepherds, and golden retrievers, approximately 50% of dogs that are over the age of 10 will be diagnosed with cancer. That's roughly 6 million dogs every year. The most common type of cancers in our patients are hemangiosarcoma and lymphoma. In boxers, lymphoma is the most common cancer, and for Lenny, I believe both of his parents passed from hemangiosarcoma. Most animals are diagnosed when they are late stage, meaning they are already symptomatic. When that happens, treatment options are limited, they're less likely to work, and unfortunately, their prognosis is not very good. That's where the new NuQ cancer screening test comes into play. The goal of this test is to find cancer early. It is not a diagnosis, it is truly a screening test. This test has a 97% specificity, meaning that it is a very low false positive rate. It will find about 70% of your systemic cancers like hemangiosarcoma and lymphoma, and around 50% of other types of cancer like mast cell tumors. It's important to note that this isn't including all of the types of cancers, but it is finding some of the more common ones. The top 2 cancers that it diagnosed were hemangiosarcoma and lymphoma. How this test works is essentially it is a blood test that comes back as one of 3 categories. You have your low risk, meaning it is unlikely that this pet has cancer. There is the kind of caution or gray zone. This is where the number is elevated, but it is likely from something else like handling and less likely to be cancer. And then you have your high risk, where cancer is likely and further testing is indicated. In general, the recommendation would be to run this test every 6 months in patients that are 7 years of age and older. However, in your at-risk breeds, such as boxers, German shepherds, and golden retrievers, you should start doing these screenings when they're 4 years old. And guess how old this little guy is gonna be in January? You guessed it, 4 years old. So hopefully this gives you just a very basic breakdown of what this new screening test is. Hopefully it's going to bring to light cancer a little bit earlier than we would have originally, but it's important to remember that this is a new test. We still have a long way to go with cancer screening, but advancements have to start somewhere. Also, just a quick disclaimer that this is not medical advice. I am not making any recommendations. This is simply my understanding of the information that I found online. Of course, if you have any questions about your pet, you should reach out to your veterinarian. But if you have any questions for me, just go ahead and put them in the comments.